Functional Physio here. Today, I'd like to talk a little bit about the importance of glute medius strength and how weaknesses in this particular muscle can create all sorts of different movement dysfunctions, which can then lead to pain and discomfort. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, the gluteus medius muscle, it's referred to as a hip abductor, right? So essentially it does this movement here out to the side, and it's also an extremely important pelvic stabilizer. So as a result of that, it's going to be extremely important with regards to any sort of walking, standing type movements. And when there's weaknesses in this particular muscle, we can have all sorts of different movement dysfunction as well as different compensations that take place. So some of the really noticeable ones, right, would be what's referred to as a Trendelenburg stance or gait, which is essentially just a hip drop on the contralateral side of the weak glute muscle. So for example, if my right glute medius muscle is weak, what you might find with a patient is when you have them do a single leg stance, the opposite side, right, will drop. And then what you'll find when they're walking, which would be that Trendelenburg gait pattern, is each step they take on that side, the pelvis of the contralateral side will then drop as a result of this lack of pelvic stability. Now, another area that we'll notice because of this hip drop and again, lack of keeping the pelvis parallel, this can really have an impact on the same side knee. So for example, if that hip drops when I'm weight bearing on that side, there's potential for the same side knee to internally rotate. So basically collapsing inwards. So when this takes place, essentially what's going to happen is you're going to be putting an awful lot of stress through the inner portion of the knee. So for example, the MCL might be impacted then over time. So a greater likelihood of MCL sprains. There's also the potential for patellofemoral pain irritation, right? So essentially as a result of this inner collapsing of the knee, the patella will potentially be pulled laterally, and then all of a sudden we've got all sorts of different issues in terms of the tracking of the patella bone, right? And then potential irritation on the undersurface of the patella. Going along with that same theme of when we're walking or standing or weight bearing, and again, not having that support, what the literature also shows is a potentially overuse of the QL muscle, right? And again, you can imagine that just based on the fact that, hey, if I've got this Trendelenburg stance, the whole pelvis is going to be shifting to that one side and potentially shortening, right, the QL muscle, or again, a compensation on the opposite side as a result of, again, these lateral shifts within the pelvis. And then lastly, again, what we'll see is an overuse of TFL, which again can impact your IT band and then do that same sort of pull on the patella laterally. So as I mentioned, there's all sorts of different issues in terms of problems with regards to areas below where the weakness takes place, right, in terms of the knee, areas within the back potentially, again, around the hip area in general, and then again, just a general lack of stability within the pelvis, which is going to potentially cause an overuse of these other muscles that help to stabilize the lower back area. Potentially also some overuse of the paraspinal muscles of the lumbar spine. If you have any questions or concerns, feel free to leave a comment below. And thanks again for watching my video today, and have a great day. Thanks again. Take care.